When is fever a concern for young children with sickle cell? Imagine your child with sickle cell disease suddenly develops a fever. It might seem like a small thing, but in children with sickle cell disease, fever can be a sign of a serious problem. Because their spleen does not work properly, they are at higher risk for dangerous bacterial infections. Their immune system struggles to fight off bacteria like Streptococcus pneumoniae and Haemophilus influenzae, which can cause severe illness. Fever in these children is always a red flag. A temperature of 101 degrees Fahrenheit or higher should be treated as an emergency. For infants under 6 months, a rectal temperature above 100.4 degrees Fahrenheit is also concerning. Even if your child looks okay, any fever needs urgent medical attention. It is often the only sign of a life-threatening infection. Because of their increased risk, children with sickle cell disease typically take daily penicillin to prevent bacterial infections and receive vaccines to protect against common bacteria. Despite these precautions, fever still requires immediate evaluation. Delay in treatment can lead to serious complications like sepsis, which can be life-threatening. When your child develops a fever, it is important to contact a healthcare provider right away. They will likely perform tests such as blood counts, blood cultures, and sometimes chest X-rays. The goal is to identify the infection quickly. Treatment usually involves giving antibiotics through enrollment 4 within the first hour after arriving at the hospital. Sometimes, children need to stay in the hospital for observation and treatment. Parents should always check their child's temperature before giving any fever-reducing medicine. If your child has additional symptoms like trouble breathing, excessive sleepiness, irritability, pale skin, vomiting, or diarrhea, seek medical help immediately. These signs can indicate a serious infection that needs urgent care. In summary, any fever in a young child with sickle cell disease is a serious concern. Because their immune system is compromised, prompt medical evaluation and treatment are essential to prevent severe complications or even death. Always trust your instincts and seek medical advice quickly if your child with sickle cell develops a fever. Remember, early intervention saves lives.